Welcome back in. In case you didn't know, this is Gastroparesis Awareness Month, a condition where your stomach muscles fail to contract normally. Dr. Vitta is the gastroenterologist with Brookwood Baptist Medical Center. Joins us now with more. Good to see you this morning.
Thanks for having me.
And we should mention his practice is right down the road there in Homewood. So first of all, what is gastroparesis? Give us more explanation.
So you started to explain it pretty well. So basically gastroparesis is when the muscles in the lining of the stomach fail to contract normally. We normally think of the stomach as a big pouch that holds all our food, but it has to do more than that. It actually has to push the food through to help it get into the intestines to digest. And so gastroparesis occurs when that doesn't occur.
So what are the major issues if this happens, and also how would folks know they even have it?
Yeah, so the primary symptoms of gastroparesis are nausea and vomiting, but you can also have bloating, abdominal pain. Usually these symptoms occur after meals.
Oh, okay. And so, because I know a lot of people who feel like, oh, there's just something not right.
Right.
But they've never been. They should really get diagnosed with it. Is it an easy diagnosis?
It is. So it's a clinical diagnosis. So it's based on both the history, what you tell me as a patient, what your symptoms are, as well as some additional testing that can be done.
Now, is this something that's hereditary? Does it just happen in people? Does it matter what gender?
So gender, hereditary characteristics aren't as important as far as the main causes of gastroparesis. The biggest identifiable causes are diabetes, post-surgical complications, medications, and then in a large chunk of patients, we actually can't identify the cause.
All right, so the most effective treatments for this, if people do get diagnosed with it?
Diet is the mainstay of treatment. So we recommend patients use a low fiber, low residue, low fat diet. So they focus on eating foods that are easier to digest.
Low fiber. Okay, well that's obviously, normally you're trying to recommend just the opposite. So, but if you have this condition, less fiber there. So anything you can do to prevent this?
Not necessarily, unless we're talking about some of those identifiable causes. So if you have diabetes, make sure your blood sugars are under very good control. If you're using particular medications associated with gastroparesis, try to minimize the use of those medications. But like I said, in a large percentage of the patients, we can't identify the cause, and so it's kind of hard to prevent.
All right, while we got a moment, Dr. Vitta, we were having an interesting conversation about probiotics, prebiotics. You see a lot of products marketed on the grocery stores these days on those. How effective are they? What does the research say? How effective are they?
Yeah, so for general gastroenterology symptoms or prevention of GI problems, there's not a lot of good data to suggest that probiotics do a whole lot, okay? But we do think that if you have some GI symptoms and particular conditions, probiotics from dietary sources, so fermented products like kimchi or sauerkraut, may be more beneficial than the synthesized products. And then prebiotics, there's a lot of stuff marketed out there, but the ultimate prebiotic is dietary fiber. And so getting a lot of fiber in the diet is very important because it feeds that healthy gut and a healthy gut bacteria. All
right, good information, Dr. Vitta. We do appreciate it. Thank you so much. And Mickey's going to be glad to hear about what you just said about the fiber.